All right, we're going to get started, everyone. Thank you again for joining us today. This is actually probably going to be our last Army Online seminar. It's crazy to think we've been doing this for so many months now. But thank you again for joining us. And today we'll be featuring Major Bethany Gardner. And thank you again for speaking with us today. And everyone, welcome to our Health and Wellness Army Online seminar. Without further ado, Major Gardner, feel free to take it away.
Thank you, Ms. Lomas. Welcome, everybody. Glad to have you all. It's my pleasure to continue to be part of the ongoing relationship between the Army and AECT as we work together toward excellence. So I thank you all for the work that you do, providing the skill sets for our kiddos and teaching them the skills they need for success in their lives and careers. My goal today is just to provide some information on how health, wellness, and fitness can influence a student's ability to learn and how that's a best practice for life over the long range of years that we live. I'd also like the seminar to be interactive, so please stop me anytime if you have a discussion point or a question that I can answer. Really, there's no wrong questions and there's no wrong time, so just jump in when you need to. But before we get started, I'd like to know a little bit about you guys. If you don't mind, would you please introduce yourselves and let me know what area of education you're in?
I know we have quite a few shy people on call usually, but feel free, again, we have the chat box open. If for any time you don't feel like interrupting the speaker, or you're more than welcome to use the chat box, and I'd be happy to coordinate that with Major Gardner.
I'll go ahead and get started then if there's nobody that wants to chime in just yet, but please feel free to use the chat box if you'd like to. Oh, I'm sorry, my mouse isn't working here. There we go. So basic questions for today. A lot of people feel like genetics may be solely dependent and engages our ability to learn entirely. But there's other questions out there on whether the activities that we do during the day and the environment that we put ourselves in, whether that makes a difference in our ability to learn and our success. So that's kind of what I wanted to talk about today. While genetics does play a large role, a lot of research has shown that the role it plays really is tremendous in academic ability, but that environment can be just as important when we're looking at individuals' ability to be successful academically. We can't change our genetic makeup in any way, but we certainly can change our environment. And some of the best ways to do that through research we found is to make sure that we get sleep, exercise, and a healthy diet. And it's been well established, I think, in society as a whole about the effects of some of the things that we can do in our environment that are damaging to our health and our ability to be successful and to learn and make those long-term memories. Some of those would be the drugs and alcohol abuse. We've also seen a lot recently on excess amounts of television or video games, but we don't really see a lot as far as what kind of things in the environment help us to be more astute learners and able to take the academia life and excel, regardless of where we come from and what our genetic makeup is. So we'll look at that today. The performance triad is a concept that was initiated by Army Surgeon General Patricia Horho, and she really highlighted these three areas for creating a sustainable, healthy, ready military force generally. And she emphasized that the ability to maintain consistent health and wellness is really dependent on influencing a patient's life space. And that life space is the time that she referred to between doctor's appointments. So on average, we spend anywhere from 3 to 5 times a year we visit some kind of medical professional, whether it's in a clinic or in the hospital setting, and they're usually about 20-minute visits. So we tend to only really be in front of a medical provider in a clinical setting for up to 100 minutes a year on average for the most Americans. So there's over half a million minutes a year that we spend outside of a healthcare provider's office. And she insists that those are the minutes and the times that we have to affect if we're going to make a change in the overall success of our medical and military force. And though the performance triad really was initiated to improve the stamina and the readiness and the health of soldiers, essentially, the benefits of sleep, activity, and nutrition are concepts that aren't specific to the military. They're beneficial for everybody across the lifespan, so from the toddlers all the way up to elderly folks. So the key points, again, we'll discuss today are the importance of getting quality sleep and how that affects our daily abilities and activities, and then our overall long-term success. We'll talk about exercise, how that influences our ability to learn and remember things. And we'll talk about adequate nutrition for all phases of life and how that's essential for optimum learning. We'll start off with sleep. Why do we need sleep? What does sleep do for us? Now, we've heard the importance of getting sleep, but I think we kind of see sleep oftentimes as just this passive activity. But really what it does is it restores our energy. It does help to fight off illness and fatigue. It strengthens our immune system. It helps us to think more clearly, more effectively. It helps to strengthen our memory, and it also produces a more positive mood. And I know we see that in toddlers a lot. When it's time for a nap, we see that. But we don't look at that in the adult life or the high school, college level near as much. But the reality of sleep and what sleep does for you is the same across the lifetime spectrum. So again, it's not a passive activity that we just do when we don't have anything better to do, just to fill our time when we're inactive. But it's something that is a dynamic process that really helps the motor and cognitive function to rest and then be as effective as possible throughout the daytime or the waking hours. It's really important to note what the consequences of not getting enough sleep are. And it's estimated, I'll just read researchers from Australia mentioned that people who sleep less than 6 hours a night typically have an impairment equal to a blood alcohol concentration of 0.05. And as we know, an alcohol limit of 0.08 is considered legally drunk. They extended that to people who work for longer periods of time, for working 24 hours straight without rest or without sleep in between, and they compared that impairment to a 0.1 as far as a blood alcohol concentration. They found that a lot of industrial accidents and disasters, such as nuclear power plant disasters, some major oil spills, those types of things all have been a result sometimes of employees or workers in those areas not getting adequate sleep. So the consequences of sleep deprivation are pretty big. For the student and the learner specifically, we see that they have a lower GPA because they don't have the ability to concentrate. Their memory and their ability to learn, unfortunately, is affected significantly. Sleep is also essential for achieving optimal health. So the more illness and colds and flu, you'll see that in kids who don't sleep well, and you'll see that in adults that kind of run themselves ragged and work long hours and don't take that time at night to recoup their body. We see chronic systems function poorly as well, chronic lung and heart problems that we see. We also see lots of high blood pressure, speaking from a medical standpoint, in patients who don't get enough sleep. Though weight gain and obesity is not something specific to learning, it does make a difference in people's ability to be active oftentimes. People who tend to gain weight tend to be a little less active, and that oftentimes causes a little less focus as well. Then a University of Pittsburgh study found that patients who don't sleep, who sleep really less than 6 hours a night, have higher incidence of depression and anxiety, which also contributes to poor performance in the academia as well. And then we kind of talked about it on the last slide, but drowsy driving seems to lead to many accidents, and they attribute the number of accidents due to people driving drowsy to be more than those actually attributed to drunk driving. And the reality is not because they're that much more intoxicated or impaired, but just that we have more people on the road that are sleep deprived than we do drinking alcohol at most times. We'll also see poor performance in athletics. People who don't rest their body, they lose that motor function, and they don't perform athletically as well as they normally would with 6 to 8 hours of sleep. The evidence supporting the benefits of sleep for the learner and overall health is pretty overwhelming. But how do we improve sleep? It's something that I think a lot of people struggle with or would like to be able to do, but people don't, I think, oftentimes know how to start that process of gaining a better night's sleep. So Consumer Reports did a study with close to 9,000 individuals, and they were having minimal trouble sleeping, not significant problem sleeping, and kind of asked them, how do you get a good night's sleep? What are your recommendations? The first one, get a right mattress, may not be something that everybody can do right away, but it's something to consider. The life of a mattress, apparently, according to the sleep professionals, say that really 6 years is about as long as a mattress will really last you. And I know most of us keep our mattresses for longer than that. But I think there's some good mattresses out there, and if you're waking up rested and you're not stiff and sore, you're probably okay in that area. But something to consider if you're struggling with sleep at night. And one of the more easier to affect and more important things is dimming the lights. A lot of people in this study found that the bright lights sense alertness in their system, and they have a hard time kind of relaxing their body into a sleep state. We have a lot of electronics these days. We watch a lot of television, I think, before we go to bed, a lot of iPads, a lot of Kindles, cell phones, all of them with those bright lights. And the research has shown that that light that we have on any of those devices, as well as our overhead lights in our rooms, really does cause a block in the melatonin, which really helps people to get to a point of feeling sleepy, so sleepiness. So the recommendation is to dim your lights and turn off all of those devices for about 30 minutes before you plan to go to bed. And that will help. Also in places where you don't get a lot of night early, block out like dark shades or heavy curtains, things like that tend to help as well. Another thing they found really helpful was neutralizing noises. So a lot of people sleep very well when it's completely quiet, and other people seem to have some kind of noise in order to be effectively get to sleep and to get to a sound sleep. But a lot of people in the study used white noise, kind of waves in the background or chirping birds, things like that. And 43% found that those types of devices help them not only go to sleep faster, but also wake fewer times at night. And then the last recommendation is to adopt a routine. I don't know about the rest of you out there, but I like to sleep in on the weekend. That's something I really enjoy doing. But recommendations from a lot of the sleep studies and from the almost 9,000 that did this Consumer Report study was really not to sleep any more than an hour later on your days off that you would on a day that you would normally go to work, because your body gets out of a rhythm and it has a hard time getting back into that rhythm Monday through Friday, even if it's something that you do every weekend and you've done that for years. But some things that are recommended is to take a bath, maybe read a book, something that's not on a Kindle with a light, and also to do some relaxation or yoga type exercises at night. The benefits of exercise, which is our second key point, really we've seen the benefits of reducing clinical illness, and I know that that's been well established for quite some time. People tend to live longer who are active. Cardiac disease and stroke tend to go down. We tend to have better blood pressure levels and lipid levels. And then colon cancer and breast cancer in particular see a significant reduction in the incidence of those for people who are active, as well as a reduction in weight gain and diabetes and other medical conditions. And that I think we all know very well. But the benefits of exercise are not restricted to health, really. There's a great amount of research over the past several years that demonstrates strong evidence for the benefit to learners as well. The hippocampus is a small organ located in the brain, and it's mainly associated with memory, and long-term memory specifically. People who get exercise, and the studies that they've done have looked at 30 minutes of exercise at least 3 times a week for a 3-month period, have found a great increase in the hippocampus growth and their ability to remember things long-term. So it's very helpful for students. Also, we see an increase in neurogenesis, so a jump start in new neuron development. And though the connection really between exercise and the brain isn't fully understood, they do know that they've seen in a lot of studies the substantial growth in neurons for people who do exercise, again, for 3 months straight, at least 3 times a week for 30 minutes a day, some kind of cardio type of activity. Not only does it increase neurons, but it helps to kind of prune the older neurons that are maybe functioning less effectively. So it's an overall benefit in that area. They've also seen an increase in vocabulary learning and reaction time. They did a couple of really big studies on students that they gave information to while they were riding a stationary bike, and others that were provided the same information who sat on a bench and did the study. And they offered them an hour for 2 days in a row to study those items. And people that rode the bike that were doing something while they studied cardio-related did a lot better on the test at the end. So, and they feel like they did a pretty good run of the patients or the participants across both fields. So the ones that were exercising versus the ones that were sitting on a bench really were equal in all other ways as far as their academic history. The other thing it does really is boost energy levels and focus. So patients that tend to have difficulty focusing do much better. And a lot of studies have shown that 60 to 90 minutes longer they're able to sit and focus on a textbook after exercising compared to their counterparts who didn't exercise before they opened the book. So a lot of benefits with activity. And one of the really great things, I think it helps younger students more so. I think by the time patients with ADHD hit the high school or college level, most of them have kind of learned how to direct their energy. But especially in the younger levels, and then this can be extrapolated to those in the high school and the college level as well, they tend to do better as far as drowning out excess distractions when they've exercised. So just getting up every 2 hours to have some kind of a break helps. Also, as you know, exercise helps with immunity. And students who are well and are feeling well, they tend to be able to focus better, and they're not absent from class near as often, so they have the opportunity to learn all the concepts that are produced in class every time they attend. Something I've seen that's concerning in sort of the elementary school when I used to teach at that level was they've sort of cut out PE, they've cut out recess a lot of times, and it was more of a thing that children got if they were good. And though we, personally, my husband and I homeschool our 2 kids, we keep a little boy who goes to a school here close by, and he is in 2nd grade and does not get a break at all from class studies until 2 in the afternoon. So they have lunch at 1 o'clock. I guess that's a break, but that's in the lunchroom. And then at 1:45, they go out to the playground and they have a 15-minute break. But before that time, there's no bathroom break, there's no stretching in the classroom. And this is something I've seen a lot of elementary schools go to, but it's because I don't think we've understood the benefit of some activity and movement and helping children to focus and to gain the memory that they need out there doing some kind of break, especially just the 20-minute recess period will help some people. And then the last key point is nutrition. And I know we all know that eating well is good for our bodies and it's better for us all around. But it also is really important for learning, and I think a lot of people don't maybe make that connection as well. So some of the things that are really important, and a lot of medical providers will say you've got to eat breakfast. Breakfast is linked extensively to better results in the classroom. So according to 2 studies by Tufts University, eating breakfast helped to keep students focused not just for the beginning part of the day, but all the way into the evening hours. So it doesn't seem to matter whether you just eat breakfast, whether you start your day at lunch. You don't seem to be as focused, according to the Tufts research, even after that lunch than the folks that ate breakfast. They were focused throughout the whole day. Additionally, a balanced diet. Cognitive ability and the brain damage is halted when we eat a balanced diet. And a lot of people, we find ourselves eating a lot of the processed foods, the McDonald's, and we're driving through. We live in a really busy time now in our lives, and I think we have to really focus if we're going to affect our academic capability and our ability to learn and retain information on how eating and planning our meals so that we're not stopping off at places that provide higher fat, higher processed items, because they have been found to actually cause brain damage, which reduces our ability to be able to focus and to remember things. Again, on limiting the processed items, you can have Thanksgiving and enjoy your pumpkin pie, and at Christmas time, enjoy your peanut brittle and all those great things. Not to say that you should never have processed foods or fatty junk foods, but they need to be more of a treat, something that you eat occasionally and not daily. Limiting the processed foods has shown that has reduced the difficulty with brain synapses. So those who eat a lot more in the way of processed foods tend to have less flexible synapses. They're more fragile and easily disturbed and unable to perform their job correctly. And then the last thing that's very important, especially in the high school, college level, is the omega-3 fatty acids found in things like salmon and walnuts, kiwi fruit, those types of foods. They really help to increase learning and memory. And a couple of studies out of the University of Pittsburgh showed that they help fight mental disorders as well, the depression and mood swings, as well as schizophrenia and dementia they found over the long term. So students that they supplemented for 6 months with the fatty acid supplement scored higher on math tests by more than 30 points than those who are not offered the omega-3 fatty acids. So again, something to consider in your diet to add those items. And then obviously, not eating the junk food, so cutting out the junk food most of the time. Okay to have on occasion as a treat, but daily really affects your cognitive abilities over the long term. And then excessive calories. People who consume excessive calories, again, that decreases the flexibility of their synapses when you gain weight. And that, according to research, is shown to be very limiting as far as your ability to remember and focus over a long term. So you can see all these things are very circular. We've looked at some of the research that showed eating, improving your nutrition, but not making a change to your sleep or your exercise, and the benefits were minimal. Same thing in all three directions. So really, this is kind of a perfect trio, and as the Surgeon General calls it, a perfect triad, the performance triad. To perform well, these are really the top do's that you must get. And it's easier, I think, at the elementary school level to say, we provide better meals in the class, in the lunchrooms. We ensure that we get them out for recess, and we do PE several times a week to get them their exercise. I think it's easier to do and to implement really in the classroom practically for younger children. But when you're looking at the high school level, or especially the college level, it's harder to find a way to implement these into the classroom. But what I think you can do a lot of times is look at really having your students challenge them to keep a log of what they do. When do they go to sleep at night? What are their activities before they go to sleep? How many times did they wake up? What did their diet look like? Using one of these apps like the FitnessPal or any of those the free apps that help you calculate the kind of fats you're getting and the kind of calories you're eating per day, and then some kind of an exercise tracker. I would challenge them to do that for 2 weeks, and then ask them to find something in each of those categories to change, to improve each of those categories, at least, one thing in each of those categories, and then do another, month and a half to 2 months if your semesters last that long, and see on there, keeping kind of a calendar of how they're doing in those sections with the improvements they've made, and see how they feel overall. Some of it is just, I've had a lot of students, nursing students in particular, tell me, I don't have time to exercise. I've got too much studying to do, and there's certainly no time to sleep. I have to go, I'll probably study till 2, and then I've got my exam at 7, so I'll be up at 6. I'll get 4 hours of sleep, and I'll do okay. And these are the students that are struggling in their classes. And my recommendation, or really my statement to them would be, you don't really have time not to sleep, and you don't have time not to exercise, because you're not helping yourself academically in any way. Your ability to remember, your long-term memory, your ability to focus, and to perform well in all areas of your life is really hindered if you don't hit these three correctly. So that's the things that I would push. Is there any questions I can answer out there, or any comments that you might have for me? Okay. Well, thank you all for participating in today's seminar. It was nice to have you, and if I can answer any questions, my contact information is available. Please don't be afraid to shoot an email my way or give me a phone call. I'd also like to remind you that there's more information on the online seminars at www.armyedspace.com. And I thank you all for your time and effort and for all that you do for our students, and I wish you all the best of luck.
Thank you so much, Major Gardner. I greatly appreciate you coming out today and talking to us.
My pleasure.
So for a lot of these online seminars, I know people have been asking about them, and we actually do record all of our online seminars here at ACTE, and hopefully within the next few months or by the new year, we should have them up and running on our website. So please be patient with us, but if there aren't any further questions or any comments, thank you again for joining us today, and if you have any questions or concerns regarding our online seminars, feel free to email me. My name is Celia Loomis. I'm the Digital Media Coordinator here at ACTE, and my email is sloomis@acteonline.org. And everyone have a great day, and thank you again for joining us.